it's coming. A minute.
What we're doing today is the 5th of a series of trainings for area hospitals. All of the hospital systems in the county have gotten together, and the County of San Diego, with the emergency management system, is providing uniform training to all area hospitals on chemical awareness and chemical mass decontamination. Coming with a backboarded patient. These are a 16-hour class covering 2 days. Then we bring them out and we create an incident. The incident today was simulating a drop of a solvent in the hospital that contaminated 3 or 4 of their hospital staff. So rather than shut down a hospital or have to wait for an engine company or fire crews to show up to help with Decon, they are perfectly capable of doing this.
In the back, there's just a plastic snaps on there. So you want to make sure that's on there good and tight.
They have grant equipment that was purchased back in 2004-2005 time frame. We're going over it again. We're going through the procedures and protocols. We're giving them a chance to play and suit up and exercise the equipment. Within 7 minutes, the inside of that suit is going to be 100% humidity. Within 9 minutes, it's going to be 20% hotter inside than outside. The suits they are wearing are exactly the same suits that the Hazmat team would wear going into a drug lab, going into a chemical release, going into a nerve agent attack. The only difference is the hospitals tend to use a hooded respirator rather than a mask respirator. They prefer the hooded respirators because one size fits all.
Backing out. Watch yourself.
The trailer is basically a very compact shower system. There's 3 lanes in there. 2 lanes are for walking people. 1 lane that you see the rollers on would be for somebody that showed up in an ambulance on a backboard. And we will have 2 people in there or 3 people dressed up who will remove the clothes from the victim, soap and water, wash them down, and then be able to get them clean and push them out the other side, where they'll be received and taken over to the emergency room entrance and treated for their injuries. The 2 next to that, 1 could be for males, 1 could be for females. The person will take off their own clothes and they will then take a bath. They will then shower off. There will be somebody from the hospital system dressed up in there to help guide them, provide them with soap, and make sure that they get cleaned up enough and try and answer questions as best you can while in those masks.
The biggest value is getting to work with the other departments, other hospitals in our community, and seeing what their training standards are and how they do their process.
Keeps everything outside of the hospital. It keeps us from having to shut down a hospital. If you shut down one of the major area hospitals, like UCSD is a major burn and trauma center for San Diego County. If I lose UCSD for something silly like a contamination from a patient, that's not good. That's not good for the county, for the city, for the citizens.